Now, hi everybody. Today we have the honor and pleasure of having Dr. Siddhartha Saha with us. He has passed his MCI screening in his first attempt this year with a score of 170, and I wanted to talk to him and take out from him his journey, and I also want to find out that if we can create some inspiration for future MCI screening aspirants. So Siddhartha, how are you feeling now? What is your feeling in your mind today?
Feeling great, kind of. Actually, I've waited for this day, kind of, to clear the MCI. Like after going to outside India for
So
studying.
where did you go for your graduation?
I went to China, Guangzhou, from a university, Jinan University, and it was just like it's a kind of mixed feeling also. But actually, right now I'm feeling great because of clearing the exam in first attempt. That's it.
So now, can you tell me about when did you actually start thinking about MCA screening? Like when you went abroad, did you think about MCA screening as a factor, or when did it hit you seriously?
Actually, my father is also a doctor, like was a doctor, so it actually helped me like to prepare myself, like when you have somebody in your home. So actually, when I went to China, people told me like when you're going outside of India, like you have to be aware of the exam, MCI exam. But frankly speaking, like initially you should not think on it. Like you should just focus, like as people study in India, like you have to study books, like you have to study, go through like the subjects like anatomy and other subjects like physio, biochem. Thing is, like, make sure you study as you're studying in India. Like don't think about MCI too much. When the time comes, like it will come within yourself. Like we are in fourth year now. Like I actually started myself preparing from fourth year, like fourth year second semester. Like then I thought to myself like we have to clear, like I have to clear it in my first attempt. Like it should not make, like I should not stay like for this exam like on a stagnant phase for like 1 year. Like in first attempt I should like.
So did you focus on the textbooks, or was your idea like, because what I find is a lot of people who are abroad, so when they are studying for MCA screening, they get misguided to buy a lot of guidebooks, and instead of focusing on the textbooks, they focus on guidebooks. What is your take on that? What was your focus in the fourth year? What did you do?
Thing is, there are like a lots and lots of guidebooks here at this present moment. But thing is, in like again I said, like in MBBS time, just you have to study the books. Like if you have a good concept built around it, and like then like few days back, one of my junior asked me like, "Bhaiya kya padhna hai?" Like for the MCI exam. So like I said, like don't think about it right now. Just study the books, like the normal, like the textbooks of surgery, medicine.
Which book in
like
surgery
Davidson
did you read?
in
Okay,
medicine,
Davidson and
Belly Love in surgery.
okay, like what Indian graduates would read.
Like what, like the thing is, like you have to you should not feel when you go to like outside India like you are different from an Indian graduate. Like you should feel like, okay, fine, I'm also a doctor now, I also have to prepare for an exam called like the PG exam. That's it. Like don't go after any textbooks. Like I mean, like do not go after any like MCQ books. Like first build your concepts, and as time comes on, you see the questions, you'll feel like, हाँ मैंने देखा है कहीं पे, like सुना है कहीं पे, ये बात अंदर से ही आएगा. Like you cannot like read MCQ books and like think like, हाँ मैंने I have finished that MCQ book and that's okay for me to clear the exam. Things are not like that actually.
So when you came back to India, you joined us for the regular course for MCA screening.
Yeah.
So how was your experience with DAMS?
Frankly speaking, like again I told, like my aim in China for 5 years was just to study like as a normal student. So I kept to myself like उसके लिए 6 महीना अलग से मिलेगा MCI preparation के लिए. Like that's a different entity. This is like in 5 years that's a different entity. Like preparing 19 subjects in 6 months is a different job, and learning 19 subjects in 5 years is a different job. So like the experience was amazing. The teachers like they really helped me a lot. It's like some subjects which I was like really weak, like orthopedics, ENT, obs gynae. I feel myself pretty much lucky like to have those teachers, like especially, and also I missed on the fact surgery also, and also Dr. Arvind who taught us medicine. They were like pretty good.
Very amazing teachers.
Yeah, very amazing teachers.
Yes,
yeah.
yes.
So like they really helped me a lot. Like actually the entire thing, to make it concise in a few hours and to make you prepared for the exam, that's actually the bottom line of how to prepare like in a 6 months, and you have to clear it in your first attempt. That's it.
And when you gave the MCA screening exam yourself, What was the paper all about? Like, you found it more tougher, or you found like more conceptual, more visual? What was the exam? Because many people listening to us would be like right now preparing for MCA screening, or would be in different years in medical schools in China, Russia. So they want to know what is the paper all about.
Um, just before the exam, when like I was talking to other people who have given like multiple attempts there, they told me like it was more of like you have to remember the concepts more, like they told me like there are some like one-liners questions, or like less of image-based questions like that. But actually the thing is, when I gave the paper, things were like more conceptual questions. Like I'm pretty much sure, as far as I can remember right now, round about like 150 to 160 were based on conceptually. Image-based questions were around about like 15 to 20, like 10 coming from radio and 5 to 6 I think from dermatology. So things are becoming more like visual oriented. I'm pretty much sure in coming exam it will be like more visual oriented, because it's no more like previous days where we have to like mug up everything, one-liners, nothing like that. It's more what you see, what you can understand from those facts, conceptual, like eventually it's conceptual thing, that's it.
Okay, so now you have told us very important points that I want to share with future aspirants as well. That when you are in your medical school, what he says is, and this is exactly what Indian graduates do. When they are in medical school, they focus on good quality books. They focus on textbooks, and nowadays even for the PG entrance exam, the NEET PG, the guidebooks have become more or less obsolete, because they are not repeating questions. They are asking more conceptual, more visuals, more pictures with arrows on it. So if you don't understand, you will not be able to do it. If you mug up facts, like his seniors advised him to mug up facts, but he said no, I want to understand. And that has made all the difference, and that has saved him 1 year of his life. And today he's done with his MCA screening in his first attempt. He's looking for internship, and the chapter is over now, and he's looking at even going further now. So I want to ask you here, that now that you have done MCA screening in first attempt, now do you feel more confident about going a step further and doing and cracking the PG entrance exam as well?
Yeah, actually started with all started with how I selected dance also. Like few of my seniors also told me like things are become like there's not much difference between DNB, NEET PG and MCI. Like that's a very fine margin. So like again as dams say, like why beat around the bush when you know who is the best. So like I decided to select, that's why I select dams. So my preparation was solely based on like NEET PG. Like in between I have a station called MCI. I have to stop there, I have to clear it, but the ultimate aim was always PG. My father also told me, like always, he used to always tell me like MBBS is like you have to do it, yeah fine, but PG should be your ultimate aim. So keeping that behind the mind, like I focused on more on like the PG things, and like which helped me for the MCI exams. That's why again I selected dams, and it was like what to say, like
Platform, or
it was like really a good platform, yeah, kind of. Yeah.
So now so with this, I feel that we have found out a few important things from him, and I would summarize them. This year the paper was not a repeat paper in MCA screening. They had a newly framed questions. More, according to him, he says 50-60% were more conceptual. Maybe out of 300, like 20 were visual. Visuals were more clinically oriented, like radiology, dermatology, rather than the first prof visual or second prof. They were more clinical visuals, like X-ray image, CT image, like, or they had like in a abdominal, you identify the organ. So this is the kind of pattern that the exam is moving at, and I want to share with the listeners that this is the kind of style of questions that even the PG entrance exam is moving towards. So my take from him is, and I feel that he would actually repeat it after this, would be that he started early. That is very important for everybody who is sitting abroad listening to us today. Start early, focus on textbooks, do just like an Indian graduate would do, read good quality books. Don't look for shortcuts in the initial phase. He did not look for shortcuts in any initial phase, and keep your final goal in mind. The best thing that I like about him is, and the reason I took his interview was because he said that MCA screening को एक पड़ाव की तरह देखा, and it's just a stopover, and his final goal is to actually become a postgraduate. So he thought that this is just one thing that he has to pass, and he did it in his first attempt with good scores. Now I will want him to say, a motivational line for future aspirants.
Just I would just say actually, like take your decisions by your own self, and don't think it's whether it's right or wrong. Just make it right. Like I selected dance, just like my friends joined different institutions, but I was the only one from university to join dance, and like it was my own decision, and I never thought what it would be right or wrong, but just you have to make it right always. And there are
Have
teachers here who's gonna help you.
faith in yourself.
Yeah, you have to have
yourself.
faith in yourself. Yeah, of course.
So that's a very positive thing. Have faith in yourself, decide for yourself, and on behalf of DAMS, now we are very focused on MCA screening, and we have a dedicated regular batch running for MCA screening now, and we are also running our courses in some universities in China, like Tianjin. We are running classes in Tianjin today, and we are looking forward to help more and more foreign medical graduates pass this exam and make this as a platform for further PG entrance as well. Thank you very much. We're signing off from DAMS, and we wish him all the best. And I'm sure I'll get him back after 1 year for an interview after his PG entrance exam as well.
Thank
Thank
you.
you. God bless.